Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Yeah. Meglitinides. So in the meglitinides we have repaglinide, we have natiglinide, we have repaglinide and natiglinide. Mechanism of action is almost similar to that of sulfonylureas only. The advantages of meglitinide are they have shorter duration of action than sulfonylureas. Okay, then these meglitinides are actually they are better suited in elderly, and they also have low risk of postprandial hyperglycemia. Okay, then the side effect of meglitinides are they can cause hypoglycemia as a side effect of meglitinides, rapaglinide and natiglinide.
thank you and thank you for watching.